All right, everyone. Welcome to the Hormone Genius podcast. I'm here with Teresa, my co host, of course, and Kitty Eisenbeil. She is an LIMHP and an LMFT, which I will have her explain that as we get started with the interview. She earned a Master of Art degree in counseling, marriage, and family therapy from the University of St. Thomas, St. Paul, Minnesota, and completed her training for licensure in Las Vegas, Nevada. As a military spouse, she has worked all over the country and maintains licensure in 4 states. Kitty has over 12 years of experience in mental health facilities, working with the military in private practice and with mental health agencies. Kitty has trained extensively in trauma therapy, utilizing EMDR, accelerated resolution therapy, part psychology, and military resilience training. Oh my goodness gracious, Kitty, we are so excited to get to know you more.
I'm really
Welcome to our
excited.
show.
Thanks. I'm really excited to share all about me.
Oh my goodness gracious. Well, why don't you just kind of share what those acronyms or the not the
Yeah.
acronym, the
What
whatever.
those all those little letters
Yeah.
after my name mean?
Yeah.
Yeah. So my initial licensure is LMFT, licensed marriage and family therapist. And then in Nebraska, they have the licensed independent mental health practitioner. So I don't need to practice with a supervisor, basically, is what we're telling you. Yep, but I've been licensed in 4 different states: Iowa, Nebraska, Colorado, and Texas, an inactive license in Nevada. So I don't use that one anymore. But yeah, I have those 4 states, and I often consider adding more when I meet people in different states who talk to me. And I'm like, maybe I should just get licensed in your state, and then you can do telehealth with me. That'd be
There we
great.
go. There we go. And so, Kitty, we're so excited to have you on because we have not yet interviewed somebody in this mental health sphere. But gosh, I mean, the more we think about it, it makes sense, right? If we're going to the counselor and we're needing therapy, of course, for good reason. I mean, that's what therapists are for. But if therapists aren't formed to understand the female cycle and hormone fluctuation and how that impacts our mood, I mean, that's a huge gap with care. And so, Kitty, that's why we're so excited to have you on our show. So, again, welcome. And so, tell us how you kind of came to be interested in therapy, and then we can kind of dig in more in terms of how you incorporate hormone awareness with your clients.
Absolutely. So when I was in college, I went down the psychology route, just as kind of more of a basic, like, I think I can get a lot of different places with this degree when it comes to going to grad school. And then when my husband and I were going through our marriage prep, we had a marriage and family therapist leading our marriage prep weekend in Minneapolis. And I just loved what he was talking about. Everything he was talking about, what he worked with couples, with individuals. And I thought, oh my gosh, that's what I want to do. And so when we got back home, I started applying to grad schools in Minnesota, I knew we were going to be living after we got married, and ended up at St. Thomas at their program. And they have a specific marriage and family therapy track. So you do counseling psychology as your general degree. And if you want to get an LMFT, you do the marriage and family therapy extra track, which is an extra year of class and an extra 3 months of practicum. So I did that and had an idea of what I wanted to do, which was never work with kids, never work with like severe trauma, just like kind of the basic individual, do dialectical behavioral therapy with people and cognitive behavioral therapy with people would be great. And then we moved to Las Vegas, where I was thrown in with all the kids and all the sexual abuse trauma and all the dissociative identity disorder. And I fell in love with doing trauma work, absolutely fell in love with doing it. And as my kids get older, I find I want to work with younger kids less and less, because it's kind of, you turn into more of a parent. You start to parent your clients more when they're the age of your own children. So I'm kind of working my way out of working with kids and focusing more on adults. But one thing that has happened over the years for me, through my own hormone story, I guess you could say, is I've developed my soapbox in therapy. So any woman who comes into session with me is going to get asked, tell me what you know about your cycle. Because in my own story, so we practice, this is the personal stuff, right? Before we got married, we had to take natural family planning courses. and we did the symptothermal. And I think every single woman who practices NFP, who learns it, you start off with one, right? And you learn it and you're like, I'm going to do this. And then you have a kid and you realize, crap, this doesn't work for me anymore. Like symptothermal did not work for me after, as soon as I had one kid, it just didn't work for me. So through talking with people, um, mom, sisters-in-law, friends who practice, discovered my own, like, oh, I need to use a little bit of this method, a little bit of this method, finally found the one that worked for me, right? It's no one specific one. I grab a little Creighton, I grab a little symptothermal, I grab a little Marquette. Like I do the things that work for me. But it was a process. It was like a solid year of figuring that out on my own. And then after, between baby number 3 and baby number 4, I have 4 kids. Between 3 and 4, I started developing really severe migraines. And after number 4, they were really bad. Like starts in the morning and I feel the buildup. Like as soon as I wake up in the morning, I know it's a migraine day and feel the buildup. And by 5 o'clock in the afternoon, I'm in bed, lights off, cannot do anything. Like it would be I got to get home now because in another 20 minutes, I won't be able to drive, like I'll have to either pull over and throw up, or I'm just like I can't see. And knowing my cycle, I knew it was hormonal. It happened at the same time. I knew exactly what was coming next. And I went to the doctor. And it's important to note that with my first child, I had a DVT. So I had a history of blood clots already. So I go into the doctor after my daughter was probably about 2 years old. And I'm like, I got to do something. These migraines are just debilitating. And that doctor, and I tell this doctor right away, do not talk to me about birth control. Don't even talk to me. I don't want to hear it. It will not be used. Right. And what does the doctor say to me as soon as I get done telling him my symptoms? Well, if you were to go on birth control, that could really help you. And all I could think was, you didn't even look at my chart, did you? Like you're like signing my death warrant by giving me something that will increase my risk of blood clots that I already have an issue with, right? I go to another doctor and I say, I think my hormones need to be tested. I think I'm low on progesterone. Like, I think that's what's going on. I'm doing my own research. I know how my own body works. And this was frustrating because she's a female doctor. And she says to me, well, you see, your progesterone fluctuates throughout your cycle. And I'm like, no duh. I've been practicing NFP for 12 years. I know there's fluctuation in my hormones. Like, just nobody listening to the person who knows her body, right? Nobody listening to the one who's coming in with a list of symptoms, with a list of things going on, and not trusting her. And so she refused to test my hormones adequately. She had one blood test and said, you're fine. Everything looks fine. So in the meantime, we PCS, we move overseas. And when we come back, we find out we're moving to Omaha. And I was, praise the Lord. I knew Pope Paul VI Institute was here. And I immediately got a referral and went over there and said, I have migraines. And the doctor I saw at the time, a nurse practitioner, she looked at my chart and she listened to my story and she said, it sounds like you have low progesterone. And I told her about how the doctor wanted to give me birth control. She's like, that would make it worse. What a terrible idea. Why would they ever do that? And they do the huge testing that they do over the course of like 12 days where they test every so many days. And they come to find out, I have like no progesterone, nothing in my body. And I immediately get put on it. And guess what? The migraines go away. Which then led me into, this is a very long story. It also led me into a understanding other things going on in my body. So I began to recognize while we were living overseas that I was starting to have symptoms during my migraines that were similar to symptoms I had when I would breastfeed my kids. I also have a disorder called DMER. And I don't know if either of you have heard of that before. It is dysphoric milk ejection reflex. Wow. It occurs they say it's rare. I'm starting to realize I don't think it's as rare as people think. Nobody talks about it. Nobody ever mentions it. Because the moment I start telling my story about it, I have at least, 1 or 2 other women who go, oh my gosh, that was me. What occurs is when your milk is letting down, the hormone is released to release your milk. it shuts off dopamine in the brain. Like it just completely shuts it down. And you can receive symptoms anywhere from feeling like wistful all the way to complete self-loathing. Mine, by the time I had my fourth kid, it started at the low end with my son, just like that wistfulness. By the time I had my fourth kid, it was the self-loathing. Like it just was absolutely horrible. And it only lasts about 30 seconds. Mm-hmm. So my milk would let down and I would have to sit there and I'd just be clenching. Like I would turn the TV on, something to distract me, and it would be the most horrible of thoughts and feelings, just the darkest, deepest sense of self-loathing and depression. And then after 30 seconds, boom, completely switched. The dopamine was coming back into my brain and I felt fine.
What was that called? What was that called?
Dysphoric milk ejection reflex, DMER.
So Kitty, the hormone that gets released when that, when you have letdown, like what's the hormone that we associate with letdown?
I don't know the hormone.
Yeah, it's oxytocin.
Okay.
It's oxytocin, which actually oxytocin is also called the bonding hormone, right? Mm-hmm. So there must be and I assume I don't know as much about this disorder either, but I understand, what the hormone process is. And I understand letdown to cause a significant change in 30 seconds. I think all women probably realize something comes over their body in that 30 seconds. Mm-hmm. This is a different feeling you're experiencing, obviously, when you're talking about this, but it wouldn't be normal, right? So it's not normal for your body to have that, severe disconnect to your dopamine response in your brain. Mm-hmm. So do they know? There's probably not an understanding of why that particular thing occurs, because usually it should be the opposite. Like in some ways you should feel bonded, right? That's exactly the point. It's supposed to make you not only let down your milk, but also say, it's my job to take care of this baby, right? To feed this baby.
Yes. It was an interesting thing. My mom, when I had my first, she made the comment to me of, it's funny they call it letdown because you feel let down.
Oh.
and it didn't hit me till later on where I realized I think my mom has it. I think she went through it as well, but because who sits down and talks about their nursing issues? Who was ever encouraging women to discuss these things? And we can get into this too, the whole idea of whoever talks about birth trauma. Yeah. As a therapist, as a trauma therapist, I often, the women that I work with that are pregnant or recently had children, or even we talk about their birth history as well.
Yeah.
We talk about any trauma they experience. I'm like, giving birth is traumatic. Mm-hmm. It's traumatic. And it's okay to process through that trauma. It's okay to bring it to therapy and process through that trauma. But nobody thinks that they should. Well, this is a natural thing. I should never complain about it. Like they feel like it's complaining. Should never complain about it or have something wrong about it. And so even the nursing thing is never brought up. And I remember talking to a friend of mine after I had my fourth, and she's like, that's not normal, Kitty. That's what you're talking about with your breastfeeding. That's not normal. And I was like, oh, okay. And about a month later, she texted me this article about a research study that had been done in Australia in 2010 on DMER. And she's like, this is it. You have this. This is exactly, I read the article. I'm like, that is exactly what's going on. And even they say, they're like, there's so few studies done on it. And just because I think nobody's talking about it, but every time I bring it up in a conversation with a group of people, there's at least one other person who looks at me and goes, oh my gosh, that's exactly what happened to me when I was breastfeeding my kids.
Kitty, let's talk about like the word trauma, because I think something I've learned, and I'm not a therapist, I have a really good friend who is a therapist, and really through talking with her, she has to kind of like throughout our time together, just in friendship, she has to kind of reset what trauma means. Sometimes for me, I would think trauma is, I saw someone die when I was 7, or something terrible, like a house fire, I got trapped inside and I couldn't get out until the very last minute, something traumatic. But, talk to our listeners, like, what do you mean when you say trauma? And maybe we can reset what that word actually means, and what trauma actually, how we know there's trauma in terms of a body response.
Yeah, absolutely. So we often say there's big T trauma and little T trauma, right? Big T trauma, the massive car accident, right? The horrible abuse you experienced, the war zone you were in, the witnessing death, all of those things might be big T trauma, right? And then there's little t trauma. And those are things that you don't necessarily register because you either want to gloss them over, or you don't think they're as bad as somebody else, or this is just a normal part of life. But you don't realize that your brain registers the distress of the event. So trauma can be rated by how distressing is this event. When we do trauma therapy, we do something called a SUD scale. So it's assessing how distressing that event is on a scale of 0 to 10. And that helps us understand how, I don't want to use the word traumatized, but I'm going to use it, how traumatized you were. So instead of saying I experienced trauma, say, how traumatized was I by this event, right? Because trauma isn't about the event itself, it's about how your brain reacted to it. And that then your brain affects the whole body, you know? And so when I'm doing trauma therapy and we do a SUD scale, I say 0 to 10, how distressing is this event? And then I say head to toe, where are you feeling this in your body? What is the emotion that goes with it? And this is where the importance of understanding your body, understanding your hormones, understanding how everything works. If you can pinpoint what's going on in your body and at what time it's happening, you can start addressing any traumas that occurred, because then you can start separating out, wait, these are things that are just my body like fixing something. This is something that my brain is just addressing something going on. Or wait, is this my brain having a maladaptive response to a traumatic experience I had when I was 12? You know?
So let me stop you there, Kitty, because I want to, because this is important. I think you're trying to say that there could be physical symptoms people are experiencing. Maybe they haven't even acknowledged their own previous little t's or big t's, and they may be having health issues, or at least things that are affecting their quality of life. So what are the most common physical things, at least in general, what you see that could be something that actually was, something that their brain basically created through a previous trauma?
So ones that we see common, and they may be experienced, as I say this, I'm sure you two will be like, oh yeah, that happens to me, because I know it happens to me. That tightness in the chest, that ickiness in the stomach, right? The tension in the shoulders, tension headache that runs up from your neck, clenching of the jaw. Some of my clients, I always find it interesting, their hands and their feet start to like get cold and tingly and shake, right? Sometimes it is a referral back to an initial body response. So clients of mine who've had medical trauma, like massive heart surgery, kidney surgery, anything like that, they start to experience the palpitations, the feelings in their chest from the surgery or from the heart attack a year later. A great book called The Body Keeps the Score has to do with how your body responds to trauma and how then it holds on to the responses and continues to do them over and over again. And so one thing I do with clients when they start talking about these symptoms, I'll often have them sit in the symptom for a second and be like, where do you feel it? What are you feeling? What's the emotion? And then I love this part. How old do you feel right now? Oh yeah, that's my favorite. Ask them how old they feel, and you sit there and ask yourself how old I feel. And if you sit there and say, I feel 12, I feel 8, usually you can then pinpoint what happened when I was that age, that my body is responding again this way.
Wow. Oh my
Because
gosh.
there's usually not something like you're not being traumatized in this moment, but there's something that your brain is picking up on that you're not even conscious of. And it's automatically throwing up the trauma response. It's automatically, even though the trauma maybe wasn't that big. One that comes to me, it's very simple. I get nauseated every time I smell almond, like a little bit. I get over it because I love almond, but I get nauseated because when I was 4 years old, I had a horrible stomach bug, and my mom was making almond Christmas cookies. And so I'm just vomiting like a 4-year-old. And it was this bright light coming in the window off the white snow because it's Christmas time. And as soon as I smell almond, that is what happens. Like my eyes hurt and I just get a sick feeling in my stomach. And I had to go, where is this coming from? And then I went, oh my gosh, the memory popped up. There it was, 4. I felt 4 years old and the memory came right back with it.
How many people do you think are out there? I mean, would you say like the vast majority of people who probably have experienced some trauma don't get help for it? That's what I would imagine. I mean, I just know from working with so many patients, there's not very many people who get through life without some little trauma, obviously. And most people actually probably have some significant trauma, you know? How many people actually get help for it, you know? And in your like mind, what do you think like the outcome could be if we actually got if we got people to actually get help for these things?
Yeah. So on the first end of that, how many people actually get help for their trauma? The actual trauma or the source, probably very few, unless it is a big T trauma and they're fully aware of like this event occurred, even then people have so much fear about it. They feel so much shame. There's guilt. There's that idea of I'm not worth it. I just have to live with this. It's a shameful thing to go to therapy. That's always a big one because my waiting room is full. My waiting room is full because everybody needs therapy, right? It is not a shameful thing at all. Join the masses. Come to therapy. You are in good company. So there's so much fear behind it that people often won't address it. And then my favorite phrase that people use, well, it's not as bad. It's not like I was in a car accident. Or it's really not as bad as somebody else's. People have it so much worse. And I'm like, I don't care about other people. You come to my office, it's about you. I've got 55 minutes that are completely focused on you and what you need and how you can be the best version of yourself, how you can live the fullest of lives. How can you experience joy again in your life? Come to my office to do that. And I only care about you. That's your time.
Mm. You know what, too? And I think there takes a certain amount of humility, right? But
Yes.
right? Because like you had shared an example like with birth trauma, right? Like when women come to your office, you ask, okay, what's your history of like birth trauma, even trauma? You were traumatized in a sense, with you not being listened to. That feels scary when you're
Absolutely.
experiencing these migraines where you can't even drive, Kitty, and you don't feel like there's help for you. That's traumatic. And so to have that awareness, B, the humility, and then C, to know who to go to and who to talk to is like extremely vital. And like even just thinking about the birth trauma part, just for example, as you were talking, I may have brought this up in a previous episode. It has stuck with me, but this idea of the importance of having community after a baby is born, and how that very first thing a mom wants to do after she has her baby, even if it was traumatizing or if it was beautiful, is to say it out loud, like relive
Yes.
every single moment to as many people who will listen. And
Who
it's
does
like,
not love and need to share their story,
and it's
right?
processing it, right? It's
Mhm.
like she's processing the whole aspect. So if she doesn't have someone to share with, or she doesn't feel like she can, if there was trauma in that birth experience, that kind of, like you said, the body keeps the score, she houses that, and so I was thinking about the importance of community and verbally processing through like the birth traumas or other sorts of traumas as it has to do with womanhood, how important that is.
Yeah, so much. And there's so much shame that women go through, like a sense of weakness if you were to say that you were traumatized by the birth of your
Yeah.
child,
Yeah.
like as if it means you were somehow less of a woman or a mother if what you went through is traumatizing. I needed those 6 weeks after I gave birth to my daughter, before I saw my doctor again, which also is ridiculous, by the way, the fact that I'm waiting 6 weeks to be checked out by my doctor after giving birth.
Mm-hmm.
I mean, honestly, I needed them because I know that I experienced PTSD from the birth of my daughter. It was a very traumatizing. It was so painful. There was so much going on, like anatomy wise, biologically, that needed to be addressed. My doctor did a really good job and he really was excellent. And he was a doctor that listened to me. And I felt so cared for by Dr. Spencer. And I was still horribly traumatized by it because of factors out of my hand and out of his hand. Like he just did what he had to do to get my daughter out.
Mm-hmm.
Right. But if you think I wasn't going to punch him in the face if I saw him anywhere, anytime after my daughter's birth, like you would be mistaken. I needed those 6 weeks to be able to talk about it, to process it. I had people coming into my house. I shared the story of her birth and all the things going on. And so by that time I went back to him, I was able to be there. I was able to be present with him because I had healing, like my brain processed the trauma and I had healing and I was able to be there for my daughter and take care of myself at the same time. But if you are so hindered by shame and fear that you're not able to talk about it and you don't have community to help bring this out of you, yeah, your body is going to hold on to all of that.
Mm-hmm. I think about birth plans sometimes. And I think over the years of working with women, I don't know, and it's probably my personality, but I've somewhat railed against birth plans. And it's not that it's not a good idea to like have a plan and to, go into your birth with some idea of what you want and expectations. But I've met women, as patients who had birth plans that when everything went the exact opposite of the birth plan, that itself was like they just couldn't handle it. It was like I don't understand. I had a birth plan. I don't understand. I had the plan. It was written out. I gave it to my doctor. So whenever someone hands me a birth plan, I'm like, this is great. I'm so glad that you've thought about, how you want your birth. But I just want you to know that 9 times out of 10, it's not going to go the way that it's written here. And that's okay, but you want to like set up your birth to know that, the goal in the end is a healthy baby that's born, and things can go up and down in directions that we just don't expect. And it doesn't mean you did anything wrong. It doesn't mean necessarily the doctors did anything wrong. It's just the way that birth is, so having that conversation with them, I think, is just important because when, you see the effects of like, it's like a postpartum PTSD.
It is.
It's not even like a postpartum depression. It's a part of just like, they don't understand why it didn't go the way they planned.
Yeah. And when you think about postpartum, what's going on hormonally postpartum already, right? You got that rush of adrenaline. What does it last? About 2 weeks? Does that sound about right? You get home, you're still like going, and then all of a sudden the crash of hormones as they just get dumped on you. Like internally, your endocrine system is a hot mess trying to make sure you're doing like your body's adjusting, giving your baby what your baby needs, all of that. And that's where like usually around week 2, week 3 postpartum is that crash of mental health stuff because you're up, you're down, you're so happy to see your child, you want to throw your child out the window, you are just so in love with your spouse and amazed, you don't want them near you at all ever, right? I have so much energy to clean my kitchen, I can't even take a shower. Yeah. You have all this up and down, and it lasts what I think about 3 months before things even start to remotely even out, and you're sitting there with this rigidity of mind thinking it needs to be this certain way. Mm-hmm. Holding on to my birth plan didn't go this way, the birth didn't happen this way. So you're combining that with the ups and downs of the hormonal drop postpartum. Yeah, you are a breeding ground of mental health issues without ever being able to acknowledge that maybe my body just needed to be like, I need to let it happen, let it be fluid, and recognize what's going on inside me.
I just want our listeners to take a minute and think, this is a therapist who's teaching us these things, and how much, like, how blessed are your clients by you having this understanding of the hormones that are, up and down during postpartum. I mean, in therapy, one would think, oh, she's going to help me get through different tactics and exercises, but just the very fact, Kitty, that you can use this knowledge to really help serve your clients, it's beautiful. It's so beautiful. And so, Kitty, as you're working with the women in your office, like, what are the things that are like your first, like the first sign that there's a hormone imbalance? Like, as our listeners are listening, I'm hoping that maybe they'll get some tips on gosh, I really do feel these ways. And I always thought it was because of X, Y, and Z, but maybe I need to take my hormone health into consideration and bring that, awareness to my therapist, even, or I mean, who knows how receptive that therapist could be. But I kind of want to dig into like what those appointments for you look like. And maybe
Yeah.
as therapists are listening, they might be able to incorporate some of these tips into their practice as well.
Sure. So when I meet a person or when we start therapy for the first time, of course, you have your standard list of questions you ask. You want symptoms. You want to find out what's going on. And for women, most symptoms are anxiety and depression. And I've noticed there's been a lot of ADHD stuff going on, which I recognize in myself too. Totally. I ADHD, but also have been spending the last 37 years managing that. So with coffee, usually it's self-medicated with coffee. Mm-hmm. But recognizing these symptoms in people because ADHD, anxiety, and PTSD, that Venn diagram has a massive section that overlaps of symptoms. And so a lot of times we're trying to treat anxiety, it's really ADHD, or it's really trauma that needs to, like, there's a trauma that needs to be assessed. So when I'm assessing symptoms, I then go into, tell me a little bit about what you know about your cycle. And I always let them know, we're going to get real personal. For women, we're going to get real personal. I need to know what's going on medically with you first, because I'm not going to jump to, oh, clearly you have a mental health issue. I want to know how your body is all intermingled, right? Like when we do EMDR, eye movement desensitization reprocessing for trauma therapy, we're doing so many things with your vagus nerve, and your sympathetic and parasympathetic nervous system, that I need to know what's going on in your body. We need to know what medically is happening, like what's the biology happening physically, what's going on. So when I know what you know about your cycle, and I often say, hey, could you just track it for the next month? Tell me, like, go on the Flow app, go grab an app, just do your symptoms, put them all in, please, for me. And almost every single one of the women that do that and bring that information back to me, we find the patterns in their mental health. And then we start talking about, hey, you know what? I know we're not talking about you starting to binge eat or anything like that, but do you know that when you're at this point in your cycle, your body is saying, don't work out as much. We're tired for a reason. Yes, go ahead and eat a few more carbs right now. Your body needs it because it needs that kick of dopamine right now, because you're not able to get it from working out. You need it through another source. And in a day, you're going to be back. You're going to be fine. And so we talk about, how do you address your mental health issues that come up to your cycle so that they fit better, and they start noticing, yeah, I just know that this is going on. I pre-game my husband, hey, you know that this is happening right now. It's not because I'm upset. I just have a hormone drop. And then their spouses are more aware of what's happening in their body. What a blessing that they can, like, the whole family can know, hey, we just need to give mom a little extra space here because her body is doing amazing things and she needs that extra support, and that's okay. So that's a big piece of it, is first asking them if they know their cycle, helping them to assess their cycle. Then I start noticing other patterns that are going on that are a little off, right? I've had several people who come in and they talk to me about having these just really depressed feelings or anxious feelings, especially around parenting. And when it is in their cycle, when it matches up with their cycle, it's usually like extended in their cycle, right? Or it'll be at two different places rather than like right before their period. It'll be right before they ovulate and then right. And I'm like, that's not usually how that should work, but okay, we'll talk about it some more. And then I might recommend, hey, you should probably go get your hormones tested. It could be that something like that could be going on. So thank goodness, again, we live in Omaha. We've got the Pope Paul VI Institute. We got Sancta Familia. We have a really good network of doctors who do actually listen. So I usually refer them there, and they come back and they say, yeah, they found out I have no progesterone, no estrogen, like everything is not where it should be at all. But the downside I've noticed for some of my clients who don't have these clinics, who don't have these doctors that are supportive, are they get the testing done or the testing isn't done at all. But when they do and find out their hormones are off, the doctors say, well, there's nothing we can do about it. Mm-hmm. Oh, well, And so we sit and we'll talk about, okay, there's some certain diet changes that you can do. There's some certain natural remedies, right? If you have high estrogen, cut out red meat for a month and see if that affects, how you're feeling. Are you eating too much soy? Like, are there other things happening in your diet? Are you, different exercises that you could be doing? Because no therapist is giving you good diet, good exercise because they want you to be skinnier. It is because everything is connected through your gut and you need to keep things moving for your mental health. So we don't need you to look better. We want you to feel better. And activity, physical activity, and a good diet help you feel better. So we do that. And then I will say, if nobody will prescribe you progesterone, Amazon sells it. You can buy it from Amazon. You don't need a prescription. Follow the instructions. And I always, of course, caveat, guys, I am not a medical professional. I'm a mental health professional. I am not a doctor, but I do know what you can buy over the counter.
And what you're talking about, Kitty, just so people understand, it's probably the creams.
It's the cream. It's a cream, and you apply it. I think it's like from peak plus 3 to peak plus 12.
Which it won't say that on the bottle, but
it'll say something like after ovulation or during this, whatever.
Usually it does.
You apply a little bit of cream to I think your forearm or something like that, or it's someplace. And 9 times out of 10, these women come back and go, night and day, changed my life.
Really?
Changed my life. I had one who came back and said, I have not felt like this since before I had children. 3 kids in, and she comes back and says, I've had so much anxiety and depression for the last 6 years. Just doing progesterone cream changed my life.
So we got to make sure too that it's like the progesterone and it doesn't say progestin. I don't know if they sell progestin cream.
No. This is just one of those things where it was like I said, I am not a medical doctor. So when we have these conversations and we talk, I always have them go to their doctor and check it out. I always say it, but I do let them know this is something you can purchase over the counter. Like it's,
yeah. And as an actual medical provider, I've had patients come in who have used those creams, and I always say to them, hey, that's fine. I also call them sometimes progesterone light. Like the dosing is usually lower than maybe what I would use. Sometimes oral therapy or another therapy can work better for certain conditions, but there's nothing usually harmful about those creams. But it's always good, to talk to a physician about it. There's so much, Kitty, that you went through there. There's just like so much that was awesome about, just one, cycle awareness, attaching symptoms to cycle, and you're right that people sometimes with severe PMS, I would say it's PMS, have symptoms around ovulation and then closer to the period. That's something common I see. You're right that you have to find a practitioner who knows how to draw hormones, which is incredibly difficult. And you're right that these hormones that are out of balance can be corrected. And I like to say, I mean, progesterone, people, the reason why it helps mental health is truly that progesterone receptors are in the brain and that it has this ability to calm kind of what we call excitatory receptors, sometimes referred to as like the GABA receptors. So there really is actually a brain connection to progesterone. And that's why we use it in postpartum, because it helps with the anxiety postpartum and that kind of wired feeling that sometimes can occur. Here's though something I want to bring up, because a lot of people, you've brought up anxiety, depression, ADHD as kind of common experiences that women might feel. Many women are like, I don't want to take medicine for that. And you don't prescribe, you're a therapist, so you're working with them more kind of on the mental health and the cognitive and the holistic aspect of it. So I want to talk to people about the difference between therapy and maybe medicine, and just what do you see in your practice? Because I don't want anyone to ever feel that medicine is bad. There are just times that medicine is a miracle for people. But I know there's lots of people out there that want to kind of do things holistically. And especially something like ADHD, people wouldn't know, like, what do I do for ADHD that isn't medicine? I've kind of only heard medicine as the answer. So just give me your kind of perspective, because I'm sure you see a lot of people on medicine and not, kind of how you manage that or what you say about those things.
Yeah. So again, I don't prescribe. That's not what I do. We do have like a psychiatrist or a nurse practitioner, a psychiatric nurse practitioner who does prescribing in our clinic. Um, and whenever I have these conversations with clients, it is the question of where do you want to start first, or what do you need to get you to the point where you can start developing or processing on your own, right? So some clients might need to start with an anti-anxiety med because they're so out of their window of tolerance. When we do EMDRs, when we do trauma therapy, the window of tolerance is this space in which you are able to tolerate distressing things, right? So you are able to handle it in an adaptive manner. You're not getting overly excited. Something gets thrown your way, and you can pretty much make your way through it with little or minimal distress, right? When you get out of your window of tolerance, it looks like you're overstimulated, and it looks like anger, anxiety. You get under, or you go the opposite direction. You dissociate, depression, things like that. And so we find that their window of tolerance is very narrow, and we need coping skills, or we need trauma processing in order to open it up. But we can't even get them into their window of tolerance unless they need a medication. They have a medication to help them get there. So they can't even begin to work on things until they get themselves into their window of tolerance. So yeah, absolutely. I will sit there and say, you need this. This is a necessary piece for you to even work on things, right? Because otherwise their day-to-day living is horrible. There's just so much stress, so many overstimulating things happening to them that they can't even think clearly. There is no cognitively appropriate response, so they need this medication to get them there. And then I watch them as we work through and we process, they start having like the opposite response. So let's say it was depression medication they needed to help bump them up. Suddenly they find themselves having uh, anxiety. And that's when we'll start talking about maybe your depression meds need to come down because you've developed some amazing skills. You process through some really big events and your brain is working differently. It's literally working differently. You think about things differently. You might not need your depression meds anymore. Let's go talk to your doctor. And so I always refer them back to their prescribing physician or NP or whoever is doing that, their psychiatrist. And I say, let's talk about taking you down off this med. But if people come in and they want to be more natural at the very beginning, sometimes I will be like, well, then we got to jump in. We just got to jump in. Let's do some processing. Let's do some trauma therapy right away. Let's do some float backs to see where things are coming from. It's going to be a rough 2 weeks, but if we jump in right away, you're going to see results very quickly. So I often recommend stuff like that. And sometimes I try and go holistic. Like there will be a lot of clients are very holistic. They want to take that approach. And so we'll talk about natural things that they can do. Like the ADHD, for me, I just needed to add a little caffeine. It was something I discovered on my own, like never being diagnosed. It was just kind of a natural thing for me to do on my own. There have been some studies done on the use of caffeine at appropriate doses at appropriate times to help. And I'll refer people back to their doctor for that. And we'll talk a little bit about different ways that they can, if they're overstimulated. I found that's a very big one right now. People getting overstimulated with the amount of stuff just in their house, and finding ways to find a blank slate to be able to clear their mind, choose one thing, do it, go back to the blank slate. So coping skills that I can give them right away. And then another piece too is engaging different parts of your nervous system. So they want to do things away without medication. Well, you have to learn how to activate your parasympathetic nervous system then. We have some skills in EMDR where you hold water in your mouth because when your sympathetic nervous system is on, it shuts off salivating, it shuts off digestion, it shuts off everything you don't need, right? If you trick your brain into thinking things are cool by salivating, having water in your mouth, it goes, oh, parasympathetic nervous system. Let's turn that sucker back on, and you calm right down. I'm telling you, try that one out. Next time you're feeling like really, really anxious, you notice your mouth is dry, just start like gathering water into your mouth, right? And just hold it there and just let it sit there for a while. And you're going to find all of a sudden you're just like really chill because your brain is going, oh, cool. We're cool. We're calm.
Oh my gosh.
Yeah.
Kitty. That's incredible.
It's a really cool tool.
Oh my gosh, Kitty.
Well, and if people don't know, the sympathetic nervous system is your fight or flight. It's your like ability to run from a bear really quickly, right? And the parasympathetic is rest and digest. It's your calm time. And so when you're in anxiety, right? We're trying to flip that. You're trying to say, let the nervous system actually flip it literally for you.
Yeah. So, and this is the point I want to make when people are nervous about going to therapy. If your therapist is sitting there helping you work your brain the way it's supposed to work, don't be afraid to go there. I mean, if your therapist is, if you're thinking therapy is all about hippie, good feelings, gonna do my crystals, if that's what your idea of therapy is, I need you to take a step back and find a different therapist, right? There are many therapists out there who want to address what's happening in your brain, in your nervous system, what's going on physically with you. Because we know that everything affects the brain, and the brain it's just this beautiful thing that it's incredible, and I love it so much. I love reading all the neuroscience articles. I love learning about it. EMDR, trauma therapy is all about brain processing, and I absolutely love it. And that's what I want. I want my clients to understand how their brain works, understand how their body works. Because when you understand it, you get to be the first person who can make change in yourself. You get to be your own advocate. You get to be the one who's doing all the work. I don't do anything for you. As a therapist, I'm doing nothing for you but waving my hand in front of your face and telling you to go with that. You are the one making change, but you have to be willing to come in, and you have to be able to trust people to start helping you do it.
If someone is listening to this and they're just like, gosh, I've thought about therapy, people bring it up to me, my doctor's brought it up, but I've always kind of pushed back a little bit. Like, what's the first step someone could make to trying to find the right therapist for them? Do you have resources for like how you interview a therapist, or how do you know if it's the right therapist? I think in my experience, patients sometimes will say, yeah, I went to a therapist a few times. I mean, it was nice, but I kind of felt like I could have just called my friend and, it would have been the same experience. And I'm like, yeah, I guess, yeah. I mean, if it's not going to move you in any big direction, maybe it's not worth it. So how do we find therapists that really are the right ones to work for our particular situation?
Yeah, anytime I meet somebody for the first time, I always let them know in session, 90% of therapy, success in therapy, is the relationship between the therapist and the client. If you don't feel confident or comfortable with that therapist, if you don't feel like there's good rapport, go find someone else. And guess what? You're not going to hurt my feelings. I want you to be successful. And if you come into my office and you don't feel like you can trust me, you don't feel like I can like give you information that you're going to walk away with and use, then why are you here? So interviewing a therapist is a really important step. And a lot of it has to do with like, I'm going to share with you the things that are going on and what I want and what I don't want. And if your therapist is not open and receptive to that, you probably need to find someone else. And that's okay. It's totally fine. Take time to get to know the people you're working with. I work in a clinic where we have 12 therapists, 10 to 12 private practice in one building. And we all know each other pretty well. We know each other's styles. So when somebody comes in with me and we talk about, hey, if this isn't a good fit, I want you to know that I'm going to find you a good fit. It's probably going to be someone in this building because we have enough different personalities that you're probably going to find one you fit with. But I want you to know that this is about your success and not mine. And so I'm going to make sure we find someone that fits you. And so it's okay to fire your therapist. It's okay to say, can we just chat for 30 minutes and see if I like you? Can I call you later and make an appointment later? Is that okay? Yep, totally fine. Your therapy is not like, even though there is that power thing, right? A therapist innately has a level of power over a client in the same way as a doctor, because you're the expert, right? You have a certain level of power. That makes that relationship a little, there's a little bit of a tension that's involved there. But in the end, you're the one paying for it. It's your therapy, you get to make decisions about it.
Oh my gosh. Oh my gosh. Kitty, new word. Oh my gosh. Oh my gosh. Kitty, this was such an amazing episode. I feel like we could talk for so long about this. I think we just
So
like dug
long.
into something big this
So long.
topic. Oh my
Yeah.
gosh, Kitty, so we're going to wrap up here, but I want to ask you that last question and I want you to also share where people can find more about you.
Mhm.
So what do you wish every woman knew about her hormone genius?
Oof. I wish that every woman knew that suffering in your body is never for it always has purpose. There's always purpose, whether it's a minor amount of suffering or a greater amount of suffering. It has purpose either to tell you something's wrong or that you're headed somewhere great.
Mm,
And so I want women to understand that you should never hate your body
mm,
because you're experiencing some suffering.
mm,
It should be what drives you to find out more about yourself
mm,
so that you can be the one who is the biggest advocate for your own health.
mm,
There's always greatness behind every emotion happening in your body.
mm.
We have that beautiful thing with the feminine genius
Mm,
that no one else has. And I
mm,
wish we'd ride that, like take that wave, take that tidal wave and ride it. It's going to make something great and something beautiful.
mm. Oh, Kitty, that's beautiful. Oh my gosh. How can our listeners find more out about you, the services you provide?
Sure. So I work at a clinic called Remedy Health. It is a clinic in Bellevue, Nebraska. It is a clinic of nurse practitioners and mental health professionals, and it's a med spa as well. So, oh, yes, it's a very nice place. We really enjoy it. We have a wonderful team. Um, from all of our medical professionals all the way to our estheticians and our mental health professionals. I absolutely adore my team. I trust every single one of them to provide anything for me, and they're very natural as well.
You said you do out of state for some states. Is that
Yep.
right?
And then, so that's my in person right now. As of right now, there will be a change coming up as we retire from the military. But I also do telehealth for anyone out of state, Texas, Iowa, Colorado, and if Nebraska. If anyone wants to do telehealth from any of my licensed states, then I absolutely do telehealth with them. So, yep, we have our website, remedyhealth.net, and we're also on like the Psychology Today. And I have an Instagram. I'm the Shrinking Catholic on Instagram. Yes. I have not been as active lately, but it is mostly humorous stuff, mostly.
And I'll just say too before we wrap up completely. So Kitty and I were on a phone call. We didn't know each other. It was like a little consult thing. And I'm like, you have an amazing personality. Like, will you be on our podcast? Like, we were complete strangers to one another, but I just loved talking to her on the phone. And now, like, after this, hour, whatever, a little less than that of talking to, I'm so glad we did because
Oh,
I
I
learned.
know. I know. That was a phenomenal phone call. I was like, this is just so great. I just love being
Yeah.
able to talk like this. It's so wonderful. Yeah. And like I said, it's my soapbox. Like I didn't know it would be my soapbox 20 years ago. You never could have told me that this would be the thing I'd be most passionate about. But it's absolutely my number one thing because I find that it is the most effective
Yeah.
between
Totally.
hormone health and trauma therapy. Man, if people did those two things all the time, I think they'd be so much happier all the time.
Amen.
That's
And I
amazing.
literally do trauma therapy for everything. So it is not just like, oh, I've had even big T, little T traumas. I'm like, oh, you have anxiety. Let's do some trauma therapy for that.
Mhm.
And people find it amazing, absolutely remarkable. And just so you know, every trauma therapist who does EMDR, ART has already done it themselves. So we come from also a personal stance of having used it for ourselves.
Man, I'm so excited. It just shows again, none of us can do this alone.
No.
I, the nurse practitioner, cannot solve everyone's problems. Like we are a team and a community, and especially as women, we know that.
Mhm.
We're so good at like saying, where else can we find a complete team to help you with your health journey? And I'm getting more and more referrals from therapists. So I think the word is spreading, just like with you, Kitty. I think people are aware that the body and hormones are so interconnected, and we need to start talking about these things we need to start talking about these things. We need to start talking about these things.
Yes.
It's just like you said at the beginning, women don't always feel that they can. And from the ages of 10 to 12, when we just start our periods, we need to start talking about all sorts of things related to our body and how we're interconnected to them. And it's just so beautiful to be able to share this, with our listeners. And we'll have to do another, I'm sure, podcast down the road where we focus on some specific thing. I think people really want to know about postpartum. People want to know about, sexual trauma, which we didn't get in today. There's so many things we need to help people with. So we'll get you back on down the road, Kitty.
That'd be great. Because the one thing, I mean, I already said, my one thing that people need to know, but I wish that people would stop telling 10, 11, and 12-year-old girls their body is broken and then hand them birth control.
Yeah.
I wish they would stop doing that, because immediately, right from the gate, they are told that what you're feeling isn't right. And that's just not true.
Right. Yeah, so true. Awesome, Kitty. Well, thank you so much for spending time with us today. I can't wait for this episode to be released.
I know, me too. I'm very excited.
All right, Kitty. Well, thank you so much.
Thank you so much, ladies. It was awesome talking to you.